I'm Dr. Kenneth Ellenbogen from the VCU School of Medicine in Richmond, Virginia, and we're here at the American Heart Association meetings in Chicago. It's a great pleasure for me to be with a good friend, Dr. Tony Tang. Dr. Tang is a professor of medicine at the University of British Columbia and the University of Ottawa. And at these meetings, Dr. Tang presented the results of the RAFT Trial, simultaneous with publication in the New England Journal of Medicine. Now, this trial is one of the most important trials in cardiac resynchronization therapy, so I'm delighted to have Tony here. Tony, tell me a little bit about the design of the trial. It's unusual in that CRT therapy was a moving target during the trial. So tell me a little bit about that.
Yes. So when we started the trial, we were wanting to know whether a CRT, when added to ICD and medical therapy in New Heart Association Class 2 and 3 patients with wide QRS and left ventricular dysfunction would be able to reduce their mortality and morbidity. So halfway through into the trial, there was an adjustment needs to be made because there are guideline changes so that Class 3 patients are deemed not to be equipoised anymore to be enrolled into the study, and therefore we then, in February 2006, we can continue the study with only Class 2 patients. As a result of which, 80% of our patients are Class 2 patients and 20% are Class 3 patients.
Well, that's really great because we do need to get a lot more information about the benefit of CRT therapy in patients with Class 2. Tell me what your endpoints were, and I have to really congratulate you on your duration of follow-up because that's really one of the other unique things about this important trial.
Right. So we have 1,798 patients. They're randomized into one-to-one proportion between ICD and CRT. And we follow them through to a mean follow-up of 40 months. There are patients that have been followed for 7 years. It's a very long-term study. It's almost an endurance race.
What did you find?
We found a very significant improvement in the patients who get CRT with respect to a primary endpoint of all-cause mortality or hospitalization for heart failure. But we also find that independently, just mortality alone, there was significant reduction in mortality in those patients who get CRT versus the patient only get ICD. And also, there are less hospitalization for heart failure.
Now, one of the most important findings of your study that you're going to have to explain, and I'm looking forward to hearing about this, is that the benefit in mortality was very striking in the Class 2, but not striking in the Class 3. Do you think that's because you have fewer Class 3 patients? Or, I mean, we really have always thought there was a benefit of mortality in those people. What do you think?
Right. I think the mortality benefit is across the classes, even though we show a very strikingly highly statistical significance in the Class 2. And the statistical significance is not so striking, and in fact, we missed the statistical significance in Class 2, only because we don't have enough patients in Class 3. But if you look at the hazard ratios, it's roughly the same.
Give us, for clinical cardiologists who are listening to this, give us 2 take-home points, 2 final messages from the RAFT trial that really bears on the practice of cardiovascular medicine.
I think now, when patients who presented themselves with low ejection fraction, wider QRS, and New Heart Association Class 2 or 3 should be considered for CRT in addition to the ICD and medical therapy. We show a dramatic improvement in mortality and reduction in hospitalization. And of course, we also shown that the Class 2 and the less symptomatic patients shouldn't be forgotten. They should be receiving CRT.
Well, thank you very much. So, very important trial. Class 2 heart failure patients also benefit from CRT. Late-breaking clinical trials of the American Heart Association and New England Journal of Medicine publication. You and your investigators have a lot to be proud of. Congratulations.
Thank you very much.